for Mike 3. Can you just pick this up? Good morning.
Good morning.
Good morning.
So, this pandemic has certainly caused some anxiety and anger and fear in our community. We had no idea at the beginning of this year what COVID-19 would do in our region, but now we're starting to understand, watching what's happening here and watching what's happening across the country. To assist in St. Louis County's response to this pandemic, we have received $173.5 million of federal stimulus grant, and we're in the process of distributing those funds in the county to those who need it most. At stlcorona.com, you can follow our transparency portal and keep track of where these funds are being spent. So far, we have distributed $10 million in funds, and we're in the process of writing checks for another $28 million in funds. In addition, we've notified over 60 recipients in St. Louis County that they have received one of our humanitarian grants and will receive part of $9 million designed to provide for needs of our most vulnerable residents in St. Louis County. And that's why we're here today, to recognize the Urban League of Metropolitan St. Louis as a recipient of one of those 60 grants. And in a few minutes, we'll hear from CEO Mike McMillan, who will tell us a little bit about what they will be doing. Now, as I've said before, this pandemic is actually three crises. This is a public health crisis, a humanitarian crisis, and an economic crisis. So for the humanitarian programs, we are focusing on senior and homebound programs. This includes providing meals, cleaning supplies, protective equipment, and medical transportation services. And humanitarian grants are also focusing on housing stabilization. This includes rent and utility assistance and legal services for foreclosure proceedings and domestic violence law. We're also focusing on technology. And these funds will focus on communication and communication needs for accessing healthcare, social services, emotional and support networks, including providing prepaid cell phones, tablets, Wi-Fi, and hotspots. And then finally, social and emotional needs of children. This includes income and help for in-home child care providers and any other needs for social and emotional needs of children or youth in St. Louis County related to the COVID-19 pandemic. We are working as fast as possible to get these funds out the door and in the community in the hands of the people who need them the most. We're currently in the process of sending out almost $19 million in grants to small businesses who have applied for this relief. We are in the process of distributing $2.5 million to federally qualified healthcare centers who are partnering with us for COVID-19 testing in our community. And we've allocated $5.9 million to support child care and child care services in St. Louis County. As this pandemic continues, we will continue to work with our community to determine where the needs are and the programs and services that will support those needs. We have also set aside an additional $7 million for access to health care in our community for our most vulnerable residents and our most vulnerable zip codes. So yesterday I also talked about the work that's going on to get kids back into school, into some sort of learning environment this fall. We're working with our schools because we understand that if kids aren't in school, some of them won't have access to healthy food options, some don't have access to breakfast or lunch except for through their school district. Some parents can't go back to work if kids aren't in school. We also know that if kids aren't in a learning environment, they risk falling behind. We don't want to see that either. So we all have a stake in the strength of our schools. The Department of Public Health has been working with leaders from schools, superintendents, teachers, pediatricians, and other public health officials to determine the right policies and procedures to safely open our schools, protect our teachers, staff, kids, and all of their families. School districts have been working on these reopening plans, and we expect to hear more about that timeline for those announcements and what those plans might look like specific to each school district sometime next week. But I'm strongly encouraging all schools to offer a virtual option for parents and to give as much notice as possible to the parents on what to expect this fall as far as timing and the design of in-class or virtual education. We know that virtual schooling is not ideal. The technology is not widely available, and access to those resources aren't fair in St. Louis County. For many families, childcare is hard to find, so we have to be sensitive and understand what virtual school might look like for those families. And kids still need to eat. We'll have to make plans for breakfast and lunch for some of these families that if they're not in school, as we did this spring. So in addition to an allocation of $5.9 million for child care and child care services, we're also looking for ways to support technology to make sure that virtual learning is available. We also need to make sure that the state continues to support our school districts for the virtual learning part of education. And I spoke to Governor Parson on Wednesday about that as well. So as schools open our doors, we'll make sure that it is as safe as possible for kids, for teachers, and for staff. So far this summer, we've distributed 74,000 masks through school districts, and we are ordering more, and we'll continue that process. Our public health officials are working with our school nurses. We have a school nurse liaison assigned through St. Louis County to help to make sure that our schools have thermometers, access to planning, protocols, policies, and procedures to keep our kids safe and to make sure that our path forward this fall for schools is as safe as possible. So I'd now like to ask Mike McMillan to come up and tell us a little bit about what the Urban League's doing to help take care of folks here in our community and how this grant from the St. Louis County CARES Act will support those needs and services.
Thank you, Dr. Page. Good morning.
Good morning.
It is a pleasure to have all of you here at our Ferguson Center. We want to thank the county executive for once again showing his leadership and making sure that those in our community that need assistance have those resources. Please join me in giving him a round of applause and for his leadership, his hard work, his dedication. I also want to recognize and ask the Urban League staff that are here to please stand. These are some very hard-working individuals who have been on the front lines of the pandemic response throughout this entire crisis, who are working day and night and weekends, and so far we have, as a result of the generosity of the St. Louis community, along with the help of Dr. Page and St. Louis County, have given away over 42,000 sets of food, that some of which you see here today, to families throughout this entire region, and are mandatorily now working 6 days a week because these distributions take place every single Saturday. So I want to thank them for all that they have done and continue to do, because of course this crisis is not over. I also want to thank the media that are here with us today, because you have been working very hard to get out positive stories and information that is much needed to this community. So we thank you. Let us give them a round of applause for being here today. In terms of the grant that we are receiving today, the $350,000 for housing, it is exceptionally important that this grant be given out to people in need, and I applaud the county government under the leadership of Dr. Page for making sure that the red tape was cut through to get this funding right away into the hands of agencies like the Urban League, so that we can help individuals who are in need. And we are going to focus on seniors and children, so mothers with children, to try to keep them in their homes, keep them in their apartments. As we know, so many people have lost their jobs, and they need food, they need housing, they need utility assistance. So we are working with our partners, Heat Up, Cool Down St. Louis, to provide resources so that the basic necessities that individuals need will be provided. And behind you, Dr. Page, of course, as you know, because you have come to so many of our events, are examples of what we have been able to give away in the form of food to, as I mentioned, 42,000 families, but that was because of the generosity of people in St. Louis, but also because of a $500,000 grant that Dr. Page arranged for us to have the ability to continue to do these large-scale food distributions throughout St. Louis County. And in addition to that, for individuals that cannot get out to these distributions, seniors, disabled, and individuals that do not have transportation, you can call the Urban League at 314-615-3600. And we are making home deliveries to individuals that do not have transportation, seniors, and the disabled. And in addition to that, we are now providing 50 different sets of these items to neighborhood churches in St. Louis County and St. Louis City in very poor areas where individuals that do not have transportation can then go to the neighborhood church, where we will also be doing our Federation of Block Units recruitment and expansion, so that individuals in those communities can go to the church as a beacon of hope, a beacon of light, and someplace that you can turn for resources in our poorest communities, where we will organize ourselves to revitalize the block units, have those neighborhoods organizing themselves, focusing on public safety, focusing on resources, focusing on having the neighborhood come together. So what you're doing, Dr. Page, is giving us the ability to tie in together people's most basic needs in the form of food, in the form of housing, in the form of utility assistance, in the form of the basic things that people need to survive. So the $350,000 that you have provided us is going to go immediately into the community, just like the food does on a weekly basis, a daily basis. And on behalf of the Urban League, we want to thank you for your leadership, thank you for your vision, thank you for the manner in which you have done this. I've had the pleasure of knowing Dr. Page since he was a state representative. He's always been a man of integrity and vision and hard work and ethics, and so it is a pleasure to work with you, sir. Thank you.
Thank you. Thank you. Be glad to take any questions.
Dr. Page, you had mentioned the $5.9 million for child care services. I think one thing that has come up in the school year, or thinking about the school year, is that kids are probably going to have to stay home with much milder, like a stuffy nose might be grounds to stay home given the current environment. That might be hard for parents, can't get to work. Would any of those child care services help with things like that?
Well, so we have guidelines for daycare and the guidelines for participation in daycare, and those are available on our website, stlcorona.com. And we recognize that this is going to be a much more difficult fall for lots of reasons. This continuum of when kids are sick or when kids might be sick and when they have to stay home is going to be difficult. But we're going to support the daycare. Those policies and procedures will be there in a way to keep kids safe, either in school or not. The question about when someone goes home with a stuffy nose, or when they only go home when they have a fever, we'll work out those protocols with the superintendents and the public health experts, and we'll make sure they're making the right decisions. But if they've got a fever, they're not going to go to daycare either.
Right. So
the same criteria that keep kids out of school will keep them out of daycare. In daycare, we're certainly worried about kids being sick, but we're more worried about daycare staff being sick, and that tends to be the area of watching concern right now. We're worried at school, we're worried about the kids being sick, but we're also worried about teachers being sick as well. So we have to make sure we're protecting the kids and the staff at school.
Right. I'm just thinking of working parents who may not always have the option to keep their kids home from school.
That's right. I mean, it's this pandemic has presented us all kinds of tough challenges that we haven't seen before, and it's shaken up the way we do things. And we're going to have to find a new path, and finding a way to take care of kids and keep parents working, and to find child care support. We're all going to work through those, but it is going to be difficult and challenging. And we have some supplemental funding from the federal government. We have a process to distribute that thoughtfully and fairly to organizations that can demonstrate that they can use it and comply with the federal law. And we're going to continue to do that. That this is going to be disruptive. It's not going to be easy. And the path is not going to be clear because this is something we haven't seen before, but we'll make our way through it.
As far as delegating funds to school districts, obviously the money available to the schools is not is is not the same. So are you guys, surveying to figure out, the technology available to students in all of the different districts when it comes to?
Well, we're going to work with the school districts. We know that some school districts have adequate technology for kids to take home and some do not. And we're going to try and identify those gaps to make sure all the kids in St. Louis County have access to virtual options. It's not just the technology, but we also have a digital divide in St. Louis County that's very well studied and described, where not all families have access to high-speed internet at home. So we have to find a way to bridge that gap as well. St. Louis County wants to participate in solving this problem. We're going to set aside some CARE funds to help with this. We will not be able to fill that gap ourselves, but we will certainly look to partner with the state, other public and private institutions to make sure that virtual school is an option where it's needed in St. Louis County. Kids aren't left behind.
What do you have to say to parents and teachers who are just still a little wary of heading back to school? You know, recognize that it's important for kids to be in a classroom, but people are feeling nervous.
I would say that the health and welfare of the kids and teachers is our #1 priority, and we're going to make all decisions starting with that. But we also don't want kids to get behind in their education, and we have to have a plan to make sure they stay on a continuum of growth and learning. Some of the extracurricular activities around school might have to be paused or modified, because our #1 priority is going to be keep the kids safe, keep them healthy, and then keep their education going in whatever form, whether it's in class or virtual or some combination. We may see some combination of in class, we may see some staggered classes. Our superintendents are working very diligently to come up with their programs. They're hard at work on this, very thoughtful ideas, very innovative concepts. They're working with the Department of Elementary and Secondary Education to get approval for these concepts, and we all just need to be flexible. I understand why parents are concerned. This is a very concerning environment that we live in. This pandemic is something we haven't seen before, so we're going to be cautious and keep the health and welfare of the kids at top of mind.
Have you heard any, concern coming from, teachers or school officials about the extra burden for teachers to, have to deal with not only curriculum, but also, keeping the kids safe if they are inside of a classroom? Are they showing any concern with that just being a lot? You have behavioral problems, you have the curriculum, dealing with online kids, in-class kids.
Right, this is gonna be more work for everyone. The staff, the teachers, their planning, and the support, because we have this new layer of social distancing and precautions to prevent the spread of COVID. All those precautions that we apply in every business sector and every institution will be applied in schools as well. And so it will be challenging for teachers. That's why they need to be a part of this conversation, and that's why they're participating in the conversation, because in the end, they're gonna be in the front lines.
We're seeing in some places across the nation, governors and elected officials kind of butt heads over mask mandates, things like that. What would you say is kind of your relationship right now with Governor Parson in terms of working together towards a common goal in Missouri?
Well, I mean, the governor and I don't agree on everything, like a lot of elected officials. But he's given us the latitude here in St. Louis County to do what we think is right here locally. And that has been helpful to us here in St. Louis County, so we can make the decisions that are specific to St. Louis County. We have held firm on our restrictions. We issued stay-at-home orders here in St. Louis County earlier than just about anywhere in the country. We were cautious and thoughtful and gradual in our reopening. We have frozen at 50% capacity in our business environment. And we have communicated aggressively business guidelines to help businesses keep their employees and patrons safe. So we still are susceptible to the spread of the virus in our community, especially if we don't get universal mask wearing up and going. We still have some resistance to that, and we're working on that as well, but it's going in the right direction. And we are certainly susceptible to the spread of the virus in the rest of the state and the rest of the country, as there is still some travel between us and other places.
Can you just give a snapshot kind of where St. Louis County looks locally as we just continue to hear about cases rising in so many places?
Yeah, so cases are rising. For 3 reasons we're seeing more positive tests. We're doing a lot more testing than we ever did. So we're picking up folks in the past that were positive but wouldn't be tested because they were asymptomatic. But we also are having more more spread of the virus in our community. We know that because more people are out and about around the region and around the country, and even here in St. Louis County. And people are about and about, not everyone is wearing a mask. We have to be wary of watching single day numbers in the tests, and that's something else I want to emphasize, because some of the national labs, because of the what's happening in our country, the national labs that process these tests are overwhelmed. And they're overwhelmed because so many tests are coming in and they can't process them fast enough. So there's sometimes a 5 or 7 day delay before we get a test result back from some labs. So those tests are sometimes reported in bundles, and they show wide variability in the numbers. So when we make public health decisions, we're watching 7 day trends, because that average is so much more important than a single day event. And and we're looking at hospital admissions, because a hospital admission is an important number, because overwhelming our hospitals is a big part of our decision-making criteria for a lot of reasons. And we're watching the percentage of positive tests in our community. Right now, we're between 3 and 4%. We want that to stay under 5%. That is one of our variables. We want to make sure testing is adequate. We want to have at least 1,500 tests a day in St. Louis County. Right now, we're testing about 1,800. We want those tests to be back in 24 to 48 hours. Unfortunately, some of those tests aren't coming back in 24 to 48 hours, so that is challenging for us. We want to see wide adoption of our public health orders. Resistance to our public health orders make it more difficult to slow the spread of the virus in our community. Those orders are made thoughtfully with the guidance of our public health experts, the guidance of the pandemic task force, and the guidance of our medical community. And we've very narrowly tried to focus them on where the problems are according to our public health experts.
At the beginning of this pandemic, the disparities in healthcare access was a huge topic of conversation. We saw that there were some hot spots in North County. Tell me a little bit about the work that you guys are doing to ensure that people in those areas are able to have better access to
Well, as soon as, so initially, well, first of all, we knew that we would have disparities. This is a decades-old problem in our region and in our country. It's a component of the systemic racism that we're talking about, and healthcare disparities and health outcomes there are multiple components that contribute to that. One of them is access to a facility or a doctor. And we knew that would be a problem. We focused our resources right out of the box. Dr. Jason Purnell was a consultant to us, a technical advisor, to help us answer these questions of equity and make sure we're applying that equity lens appropriately to all of our decisions. And when I asked for the appropriations of the grants from the county council in the beginning, I asked for it to be appropriated in a way to focus on our most vulnerable communities, and that's what we've been doing so far. Initially we had trouble purchasing tests all across the country. They were not available. Our health systems were available to purchase some tests early on. Our health systems set up the first testing centers in our community. And the first test was performed in St. Louis County, Central Corridor, West County. 9 days later, the second site was working at Christian Hospital 9 days later. As soon as St. Louis County was able to purchase tests, a few weeks later, and amid the national shortage, we set up a testing site in North County. And we will continue to aggressively test. Most of the testing is in the hotspots that initially was North County. Now we're seeing very widespread infections all across St. Louis County, not just the vulnerable zip codes where it started. That was most vulnerable at the beginning, didn't start there, but where we saw the higher frequency in the beginning, we're seeing it all over the county now. We'll continue to focus our resources where they're needed. That's what we do in government. That's what we'll continue to do. The folks that need help, whether it's public health, humanitarian, or the economic relief packages, and those small business grants are going out as we speak.
You rolled back some of the guidelines on the youth sports. Any talk of rolling back any other guidelines right now?
Well, we're going to focus on areas where we are having the biggest challenges. So we're working with our contact tracers, and that's the value of contact tracing. We have over 300 people doing contact tracing. We have folks in reserve that are ready to go. We're activating those reserves to make sure that we have adequate contact tracing available. We're working with St. Louis University School of Public Health to expand contact tracers. They tell us through their work where the hotspots are. It's a little more difficult to have a good contact tracing program if the test results are coming back in 5 to 7 days, because there's a large gap between a person who's positive and being able to chase down contacts. But those contact tracers will tell us where the outbreaks are and where the hotspots are, so we focus on those individual businesses where there's been a break in social distancing, and make sure that break is fixed. And then we look at sectors, and the sector that was causing us challenges according to our contact tracers where it was surrounding all the activities around youth sports, not necessarily the game itself, but everything that supports that game to happen is where it was all giving us lots of information about we need to make a change. We had an agreement, the day before yesterday with the pediatrician group who was advising us on those recommendations, and we had a consensus agreement. Yesterday, a couple of members of that group have expressed a change of heart, but we have no indication that the underlying group who signed off on those recommendations to roll them back has changed their mind. Questions? Okay, thanks for coming out. Thanks for being here.